I've been working for a few years now on a project called How Systemic Racism Works. And it normally did not involve a pandemic. It also didn't specifically involve health-related issues. But as this crisis emerged, my own students who have research projects related to the subject that we're dealing with today, some of them, were really interested in thinking about how this pandemic could be understood structurally. And there have been, some articles and some obviously wide variety of research on this. But I decided that I would try to think through how this pandemic in particular relates to our healthcare matters related to race, and how that might fit into this systemic process and systemic project that I'm working on. So this matters because, as I said before, the important component of sharing with people and helping them see things that are otherwise somewhat invisible or rendered invisible is very important. And the more you can come up with examples that are cogent and tangible and relevant at the moment, the easier it is to move from that concrete moment back into the network of circumstances that might be obscured. So that's what we're going to try to do today. So we're going to do a little back and forth. We're going to have to sort of set up the context of some of the statistics about COVID and race, particularly African Americans, because that's my field of focus. And then we'll try to connect that out to some systems at the same time and then circle back. That's the broad map that we're going to try to move along with. Okay. All right. So the latest available COVID-19 mortality rate for African Americans is 2.3 times higher than the rate of Asians and Latinos, and 2.6 times higher than the rate for whites. Now, this is as of a couple of days ago. And I'm really struck by how long it took the mainstream news media to report and states to gather information on this crisis based on race. I don't know how many of you have been glued to the news or not glued to the news. I've been of both minds. Some days I watch it and other days I'm totally unable to turn on the television or read the papers. But it did seem to me that it took quite a while for them to even gather data on, rates of infection based on race, as well as actual mortality based on race. Once they started gathering it, the numbers were pretty staggering. So there's sort of 2 points there: the numbers themselves and the lack of focus on the relevance of them. Way in terms of what's happening. For all US states with available data per rates of mortality per 100,000, these are the numbers that we have based on racial group. So you're looking at a substantial increase and significantly much higher rate among African Americans. Now, any deaths among any groups of people is a great tragedy here. So my point is not that it should matter more one group or another, but those who are highly vulnerable and who are experiencing extreme levels of mortality should be the focus of some of our attention for sure. So let's put this another way, because those numbers are still hard to imagine. And this is quoting from the APM lab. Research lab. The novel coronavirus has claimed nearly 69,000 American lives through May 4th. While we have an incomplete picture of the toll of COVID-19, the existing data reveals deep inequalities by race, especially for Black Americans. For each 100,000 Americans, 37.2 Blacks have died, along with about 16 numbers of Asians, 15.9 Latinos, and 14.3 whites. These rates are so disparate, it can be hard to appreciate it. And so they go on to put it plainly that if Black Americans had died at the same rates as whites, there would be nearly 9,000 of the 15,000 residents who died, they would still be alive. So that's 9,000 people who are largely gone beyond the rates that should be everyone's rates. So that's a pretty stark way of thinking about it, and I found it pretty helpful. So, so what do we do with that in a systemic or structural framework? So in order to begin to think about what to, I'm sorry, you know, my clicking capacity, this part is a little bit challenged, even though I've been at this for 8 weeks. The systemic approach that I take to these questions really require that we ask different kinds of questions about how things work and what's connected in society. And in general, I ask the first two questions on this slide, along with a third question that has to do with some other matters, which I've substituted for the third question that's quite relevant to what we're dealing with today. So if I want to say that systemic racism is impacting a pandemic, and specifically the one we're in, first I have to talk to you about what I'm calling systemic racism. What is it? How does racial inequality work as a system? Because I'm making a claim, and many people have made this claim, that, you know, it's racism is not just a matter of individual actions and personal beliefs, but that it is played out systemically in society. And so what is it? What is it? And how does it work as a system, as opposed to a series of discrete personal individual activities or beliefs? And then third, which is what we'll spend most of our time on, is how does a systemic racism analysis help explain the disparate effects of COVID-19 on Black Americans? So what is systemic racism? Now, this is a little hard for people often to sort of grasp, but more importantly, sort of swallow, because it flies in the face of what we like to say and think about how things work in our country. And certainly it flies in the face of our aspirations. So systemic racism in the United States is the normalization and legitimization of an array of dynamics. Some of these dynamics are historical, some of them are cultural, some of them are institutional, and some are interpersonal, right? So it's the normalization and legitimization of an array of dynamics that routinely advantage whites while producing cumulative, mutually reinforcing, and chronic adverse outcomes for people of color. So the systemic piece of this definition is really in two parts. One is that it is an array of dynamics, some of them taking place in the past and showing up in the present, some of them being about our cultural thinking, some of it is specifically institutional in practice, and some of it takes place interpersonally. That's one place where you see a system at work because it's happening in multiple levels, and that it is routinely creating advantages for one group, in this case we're talking about whites, while producing cumulative, mutually reinforcing and chronic adverse outcomes. So mutually reinforcing is very important here, and so is cumulative. So it's not like it happens one time in one institution for one decade, but nowhere else. That would not be systemic because it wouldn't be cumulative, mutually reinforcing, and it wouldn't be able to produce chronic adverse outcomes. So the effects of systemic racism are mutually reinforcing, and the focus of a systemic analysis is on that mutually reinforcing impact. So the operations of systemic racism are interlocking across various aspects of society, and they form a flexible, highly connected system. And multiple parts together produce an effect that is different from the impact of each part on its own. So let me just take a minute to show you how that might work. So the project, as I began it a number of years ago, was, and still generally is framed this way, I'm intending to focus on these 5 aspects in American society. I consider them to be critically important for determining outcomes and the quality of life and opportunity in society. This would be housing, wealth, education, and the criminal justice system. And media is the engine for thinking about how we develop ideas about what's happening in society. Of course, there's systemic racism in the media, But what I'm particularly interested in is where our narratives and cultural beliefs are reinforced and the ways in which that reinforcing impacts policy and practice and perception. Now, this is a systemic interlocking image of the same 5 gears. You see here, these are 5 gears separate and apart. So if we were to do an institutional analysis, we would say, what has been the history of housing discrimination in America? And we'd focus only on housing, right? And we'd only want to be interested in the ways in which we might have created segregation. And we're going to talk a bit about this, so I won't go into it. But let's just say education. We want to talk just about educational discrimination or inequality or disparities in outcomes. And that would be one aspect of a system. Now, if you want to talk about a truly systemic approach, you'd be much more interested in not just what happens in education, but how education is connected to housing and how housing connects to questions of wealth inequality, which are quite staggering, and how questions and practices and policies in housing impact and shape criminal justice outcomes and policies. So these interlocking approaches have more to do with the ways in which you begin to see cumulative interlocking effects. So why this matters is because it can be very difficult to see how what's happening in education is attached to things that are outside of education. And if you're trying to figure out how a given student may or may not be performing in a given school, you can't imagine that school to be unrelated to hunger in the community, homelessness in the community, lack of resources in the community, the criminal justice practices in that community, and so on. So a systemic approach allows us to see these interlocking cumulative impacts. So this is my project, but I made a special slide for you all today, and that is we're going to add a health gear. And so I've added, and I shouldn't say I, because I had someone help me with my emergency health gear. And I've put it in red because it's not officially part of my project, but I wanted to put it here so that we could think together about how health interlocks with these facets. Today, we're going to focus specifically on health, housing, and criminal justice. We can't possibly do even those 3 areas fully and comprehensively in the amount of time we have, but we certainly can do a little bit, and so I'm going to do as much as we can with these 3, but we'll have to save these others for another conversation, or we can certainly do it in the chat if you're interested. Okay, are there any questions so far? Okay, here we go. So disasters, and especially health disasters, amplify inequality. And so what we're seeing with COVID-19 is an amplification of existing inequality. It's such a shocking moment for many people who are not either in the communities being affected or who don't study the kind of systemic forces, that it's hard to imagine that the outcomes we're seeing are the product of existing circumstances. Somehow it feels better to imagine that it's the product of something that is just not how things are arranged. But in fact, that's usually what happens with public health crises. Same thing happened with Katrina, for example. It wasn't that Katrina created the disaster that was mostly on the ground. It would just amplify the inequality that was the case in New Orleans. So what a systemic analysis does, it explains the structures that generate the inequality that is amplified by disaster. And this I took from the CDC website because I thought it was a very helpful health-related systemic analysis. And basically what they want people to remember is that where we live, learn, work, and play affects our health. And the conditions in which people live, learn, work, and play contribute to their health. These conditions over time, remember I said history, policy, practices, over time lead to different levels of health risks, needs, and outcomes among some people in certain racial and ethnic minority groups. So today, as I said, we're going to focus on housing, criminal justice, and health. So let's jump right in, assuming I can eventually learn how to move these slides. So housing segregation in Black neighborhoods. So, you know, if you follow any of these things, you know that we have a very substantial history of racial segregation in the United States, very significant in a number of ways, not just Southern Jim Crow segregation, but ongoing, enforced, and created Northern segregation that continues to reproduce itself through a number of mechanisms. And so it's a combination both of segregation, but also of the maintenance of ghettoization. So segregation is one factor, but there's also a significant class dimension. And that means that housing segregation in Black neighborhoods are partly about the creation and consolidation of racialized poverty. And I'm going to explain that in a minute. And housing segregation in Black neighborhoods have much higher levels of homelessness and housing insecurity due to a series of factors that we're going to talk a little bit about now. So if I were doing just a big presentation on housing here with you, I would try to drill down and talk about how a whole range of policies and practices in housing, some of them federally determined and otherwise, were contributing to this. But we're just going to do a little bit of this today because we have a lot to get through. But we're going to focus for a brief moment on redlining. Many of you may know what this is, so I'll race through this. If you don't, there's a number of great books on this, and we can talk about it in the Q&A or later. But what's most important to remember is that redlining was a federally government-driven practice designed by a corporation that the federal government actually created called a Homeowners Loan Corporation. And their main job was to go around the country in the 1930s and through the 1970s, but it started right after the Great Depression, to map city neighborhoods with a color rating for whether or not certain neighborhoods were suitable for a federally backed loan. So this was the era when the federal government was expanding home ownership for Americans by creating federally backed, low interest, low down payment loans. Because up to this point, you would have to pay 50% down in order to even begin to purchase a home, and there was no federally backed context. So this was to expand that. But they were basically, it was a racial coding system. And so they were very explicit that green was the best rating and it was lacking a single foreigner or Negro. This is language from the 30s and 40s. A neighborhood considered blue was mostly white and therefore still desirable. And yellow was subversive racial elements, which meant that it was definitely declining. And this would be other non-whites beside Black people, as well as Jews. Jewish Americans were considered subversive at this point. And then red was the worst rating, which was D, which was hazardous. And neighborhoods where any Black people lived were marked in red, giving the lowest rating considered ineligible for home or business loans. It had nothing to do with class, had nothing to do with credit, since credit ratings were not even really in existence quite yet, if I'm not mistaken. But it had nothing to do with the individual people. It was about who lived there. And there were, well, I can't go into that. I was going to give you a lecture aside, but we don't have time for it. But there's some interesting data about that. So there's this mapping inequality website that's really quite remarkable. And if you can go into it and check any city you want. And so I just took this slide to give you a sense of what neighborhoods and how places were redlined and the impact over time. So this is the grading and what colors. So you're looking Chicago, Detroit, Pittsburgh, Baltimore, so on and so forth. Birmingham, Alabama, Memphis, Tennessee, etc. So you see that the system of redlining, this is a map of Baltimore. This is an actual map itself. And so you see the neighborhoods that are historically Black. Now, why this matters is because with the Great Migration of African Americans from the South throughout the 20th century, dramatically increasing the numbers of Black people, The impact of redlining was also a matter of containment, which is to say, you come up to Baltimore, you have to live here, 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 or there, and preferably not here or there, because this is expanding into predominantly white neighborhoods, green and blue. So what matters here is the fact that it's not only contained, but it's also creating consolidation and overcrowding. I think there's a question. Let's see. Is someone else running the questions, or am I supposed to figure this out? I can't see the Q&A. So.
I can help with the questions, Tricia. We do have a question from an attendee asking about the website you just mentioned.
Oh, sure. Let me go back to that. It's called Mapping Inequality. Oops, sorry. Mapping Inequality Project, Redlining in the New Deal America, and it's a Richmond, Virginia school, University of Richmond. And this website you can go to and put in under the search engines any number of places. Now, one quick detail is that, you know, what's happening with gentrification is that redlined areas are now becoming extremely valuable real estate as middle-class whites and upper middle-class whites move back to big cities. And so what we're seeing is an expanded suburban ring where redline communities are flipping with suburban rings that used to be predominantly white. So what you'll see here is that some of these big cities that have high levels of gentrification, these images would not match, but they will tell you what time frame these images are related to when you get there. Okay, so this is Baltimore. I just threw these in, you know, an East Coast and a West Coast, just to give you a sense. And gentrification has completely changed San Francisco, so let's not even, you know, I'm not sure there's anybody can live in San Francisco anymore of any background. I'm not sure. I think everybody's pretty much out. So, you know, you think, okay, redlining ended. What's the difference? What's happening now? But lending discrimination continued and continues through today. And I don't want to spend a lot of time on this, but lending is extremely important because it allows families to accrue equity and create financial stability, as well as intergenerational capacity for their children. So the lending exclusion continues. There was some research done, nationwide research found that savings and loan banks turned blacks away from home loans twice as often as whites, and the records of 10 million, sorry about that, can't highlight the slide. The records of 10 million applications from every savings and loan in the country reveal a lending gap so pervasive and so wide that in much of the country, high-income blacks are rejected at the same rate as low-income whites. Now, you know, to explain this, you know, it's hard to explain what would motivate this, except, you know, just privileges and efforts to disadvantage black people, because it makes literally no sense. When you're looking at a system of that magnitude with 10 million applications, it's not an individual matter. Subprime lending becomes a form of predatory inclusion, right? So first you have excluding people from lending, and then you have what I'm calling predatory inclusion with subprime lending. And so what they find is that high-income African Americans were 3 times more likely to be subjected to subprime terms than low-income whites. So that subprime terms are highly volatile and expensive with higher interest rates, even if they didn't qualify for them. So what does this do for systemic racism? And what is the impact, and why does it matter for what we're doing today? First of all, lack of access to credit and higher costs for credit reduces the capacity to sustain small businesses, because you remember it's housing and small businesses. And so, you know, we're going to see after COVID, I mean, I don't talk about this in the health piece of this presentation, but we're going to see that, you know, everyone's going to struggle, small businesses across the board, but access to small business loans were part of the history of discrimination. And so we want to keep a very careful eye on what kinds of inclusions for Black businesses will be part of the small business lending process. But this lack of access to credit and higher costs of credit fueled massive black-white wealth gap, which we're also not talking about today, but it is extraordinarily wide. It reduces the value of properties in Black communities, reduces the equity and the investment resources for families, creates higher levels of financial instability and housing insecurity, and produces more vulnerable access to the risks of the escalating rental rates. And so this outcomes are higher instability, higher levels of poverty, homelessness, and overcrowding. So this is a chart that I just found yesterday that I wanted to share because it shows you, this is not a race chart. This is the median rent and wages for everybody from 1960 to 2016. So here is the change in median wages, right? So this red line going down is showing that wages, when you adjust for inflation, are actually declining. Wages are going down. And this orange line is changes in median rent. So you're looking at the rent costs going up significantly and the income and value of wages actually declining. And so this is the context in which people are living paycheck to paycheck, barely staying afloat. Now, when you add racial discrimination in housing and jobs to this portrait, the numbers are for sure to be much more significant. So the broader impact of segregation and ghettoization beyond the housing and wealth and resource-related components involve physical isolation, a lack of accessible transportation, maybe not New York, that might be a bit of an outlier, but in many other cities, significant absence of public transportation. Lack of investment with businesses that can weather major economic downturns so that large grocery chain stores are not present in these communities. High levels of environmental toxicity, much more likely to be adjacent to toxic air, and I'm going to talk about that in a minute. And segregated and underfunded schools. Another topic I'm not going to focus on, but I wanted to just flag. Okay, the second big piece is the expansion of what people call the criminal justice system, but I want to call it the punishment system and race. And I'm sure many of you have heard that there's been a precipitous increase in punishment for expanded list of formerly minor activities. It's not that people were doing more of the same crimes. It's that we increased the punishment for and the level of punishment for crimes or behaviors that were previously considered health-related rather than criminal, particularly drug addiction and drug use. And so the expansion of the system of incarceration into a system of mass incarceration has been catastrophic. In the past 30 years, our nation's prison population has more than quadrupled, and that's mostly been the result of drug arrests. This is a chart showing the massive increase in mass incarceration since 1980, which was when I went to college. So it's a really, a terrifying reality that this is how much we've increased incarceration since that time. We think a lot about the federal drug policy, but it's also local jails and local and state prisons that are doing the highest level of increase. Now, this again is not by race, but in general. But when you look at who's actually going to jail and who's being put into prison, 40% of the incarcerated are Black men. Over 95% of incarcerated people are men in general, but 40% of that population are Black men, even though Black men only make up 6% of the American population. Black people are jailed at 6 times the rate of whites for drug use, despite whites using and selling drugs at higher rates. They receive longer sentences for the same crimes, so there's both a length of, there's the rate of incarceration and then sentencing rates, and a series of 3 really important practices is that the expansion of the drug war expanded police discretion so that where the police could choose to ask people for their ID and stop and frisk them at a given location expands dramatically after the 1980s. So you have a lot more police discretion, you have discriminatory sentencing, for drug possession, and then extreme sentencing. We instituted a number of 3 strikes laws, 3 felonies equal prison for life. We expanded the number of things that constitute a felony. And then we also have a bail system, which I'm going to come back to, but a bail system which basically creates a context in which poor people await trial in jail. And so they often plead guilty to go home, but more importantly, they're jailed mainly because they can't afford bail. So it's a poor people's debtors prison system. I'm going to move along from this. If you're interested in stop and frisk, we can talk about it. But the main thing I want to point out to you is that stop and frisk didn't happen in wealthy neighborhoods. Stop and frisk takes place in poor minority communities and is hidden really by housing and physical segregation. Within a year of the practice, over 80% of the young men stopped and often, searched, were African American and Latino. The sentencing disparity was this extreme for a very long time. 5 ounces of crack, which is identical, crack and cocaine are equally, they're the same drug, basically. We can talk about the details about the perception of crack as highly addictive and the fact that that was never substantiated. But nonetheless, you're talking about 500 ounces of cocaine gets you 5 years mandatory, and 5 ounces of crack. It was 100-to-1 ratio of sentencing. So we've looked at housing, we've looked at criminal justice, and we're really skimming along here. And now health and systemic racism. So access to health insurance, as we know, is a crisis for all Americans. And there's been a lot of political discussions about whether or not we should have mandatory health access. But this is not equally disadvantaged. Hispanics actually are 3 times more likely to be uninsured than whites, and African Americans are almost twice as likely to be uninsured. In all age groups, Blacks were more likely than whites to report not being able to see a doctor in the past year because of cost. Hospital closures, right? This is physical access. Hospital closures, and there have been many, according to the National Nurses United, hospital closures have had a disproportionate impact on some patient populations. Urban hospital closures are more apt to happen in racially segregated communities, and especially in African American neighborhoods. The effects on these communities is devastating, as research shows that nationally urban African Americans receive their primary and other care at a hospital compared to 1 in 6 for whites. So the absence of health insurance and the closing of local hospitals in urban Black communities mean that they're not only uncovered, but have no access even to emergency care. But that inadequate access is also driven by a long-standing distrust of the healthcare system and the financial implications associated with missing work to receive care. So everybody has the financial implications unless they, have sick pay days. But in particular, the long-standing distrust is very important. There's many studies that show that African American patients continue to receive substandard care and different care. And there's, of course, a long legacy of really gruesome medical industry uses of medical procedures to really test out drugs or refuse to give drugs to see how drugs would progress on the human body on Black people. The Tuskegee experiments, in case you're not familiar with it, doctors were basically watching syphilis and gonorrhea proceed in Black patients, and just as a study. There's, what was dubbed the Mississippi appendectomy, which was wholesale, loss of uteruses and taking out of Black women's reproductive organs when they went in for routine care. So there's significant history. There are many, many studies and research that shows this is a significant part of Black people's suspicion and anxiety about going to receive medical care. And then, of course, there are serious underlying medical conditions. Compared to whites, African Americans experience higher death rates, higher prevalent rates of chronic conditions. And some of these conditions are associated with stress and poverty. So how do we think of systemic racism in the context of COVID? So let's put some of these pieces together. So in segregated communities and ghettos, you have much higher levels of homelessness and housing insecurity, and you have crowded living conditions because people cannot afford the rent we were just discussing, and there's much less affordable housing. So you have crowded living conditions. You cannot practice social distancing under those conditions. And you have a larger number of homeless people who lack access to soap, water, PPE, and everything else. Healthcare, you have inaccessible hospitals because they're closing, more likely to be closed or reduced in services, lack of access to health insurance, fears of mistreatment, which might prevent people from going, and lack of physical proximity to other medical facilities. And then, of course, pre-existing underlying conditions that exacerbate the conditions that COVID produces. I want to focus specifically on jails, although prisons are important. Jails are before you're sentenced, pretty much. And, you know, it's kind of shocking that detention centers, jails, and prisons do not have soap, sanitizer, or toilet paper in general. I mean, there's just a lack of humanity going on, you know, that everybody reports as status quo before COVID. But when you're talking about a context with a highly contagious ailment that is airborne and that people can be 2 weeks without symptoms, you're talking about incubators for catching this disease. So I think we're really not seeing the numbers yet about what this is going to mean. But jails are especially important because if you are held on bail and then you can afford bail somehow, or you end up serving a short-term sentence for some minor infraction, you basically cycle back out into the community, into a community that is already facing higher levels of risk, and you expose more people. So the question of, you know, emptying jails, which on the one hand is a humanitarian gesture, if there is an adequate understanding of the conditions under which, to which people are being sent, then you can actually be creating a greater infection rates in the same communities that are already at risk. There are other factors that are relevant to COVID. African Americans make up 30% of the licensed practical and licensed vocational nurses, even though they make up only 12% of the employed workers. So they're in the front lines, in a very specific frontline situation, underpaid and high risk. Nursing home caregivers, home health aides are these vocational nurses. They make, even in New York City, you know, sometimes $17, $18 an hour, and have very little benefits and health insurance. And if they don't show up, they lose wages. They are not going to be paid. So you're looking at a high front-facing risk scenario that's related to this specific crisis. But there's also municipal workers, not just police and fire, but transit workers and other essential workers who are disproportionately African American for reasons largely related to the history of racialized exclusion with union work. So cities had to, once the civil rights movement required racial equality in hiring, municipal service workers began to become more and more African Americans because cities could be less likely to discriminate en masse on municipal applications. So you're looking at bus drivers, you know, other MTA workers who are now critically keeping cities mildly functional. And then there's the toxicity, which is pretty remarkable, but the pollution burden is not equally distributed. Blacks are exposed to about 56% more pollution than is caused by their consumption. So this has to do with the physical proximity. Of Hispanics, it's slightly higher. It's about 63%. So you're looking at a health environment, a toxic environment, and this is just pollution. There are other kinds of toxic factors. People who do environmental justice and environmental racism are reporting it a significant component in other ways as well. So what we see with COVID is a process by which what was already going on can create a flash fire of extreme negative outcomes because of a systemic approach. It's not prisons by themselves. It's not healthcare access only by itself. It's chronic histories in those relationships, neighborhoods, access to healthy food, lack of, the lack of proximity to healthcare facilities, and so on. That when you bring them together, and I'm not even dealing with everything, just a few things, but when you bring them together, you create, a very vulnerable canary in the mine, right? You create someone who is unable to sustain life at the same rate as people who can literally live 5 miles away. And it's only a systemic analysis that renders visible the forces and factors that can create these extreme disparities.